So the question was, how can I start to advocate for people with disabilities? So the first thing I said was, see the individual and their disability, right? And do small talks. And the second thing you can do is engage in active listening. A lot of us will just passively listen to somebody with disabilities. Sometimes the way they talk is too slow for you, so you can't really be active in listening to them. So you have to try your best to engage in active listening, right? And how do you do that? Look directly at the person. It doesn't matter how they look, you have to look at them. For me as a teacher, I have to get that eye contact. I have to let them see that I see you, right? I look at you, you look at me, we see each other. That's that's important. The second thing is you have to make sure they finish speaking before you talk. Do not talk for them. Do not come in and out of their conversation. Try your best to be as still and actively listening as possible while they talk. And when they are done talking, then you ask follow-up questions. When you're talking, just don't be like this. Who wants somebody just to stare at them like that? It's so awkward. So when they're talking, do a little nodding. So that is engaging. When you nod when somebody is talking, that person gets a sense that, oh, they're listening. Ask the question. Don't be shy to ask the question, because they want you to ask them questions, because they want you to understand them. So don't think any question is stupid or silly, right? You see somebody without legs, you all of a sudden you can think, oh, maybe they had an accident or they're born with that. Which one is it? It's okay to say, how did you come by your disability? Was it from birth, or is something that happened through an accident? And ask them, are you comfortable in sharing that information with me? Right? So you have to be really engaged in the listening part. The next thing you have to do is respect their rights in decision making, right? Sometimes we feel that we are the best people to decide for them. No, they know what they want. So you cannot in any shape or form think that you're gonna tell them what to do, how to do it, when to do it. But don't get me wrong, you have to help them consider the risk and the benefits of the decision. Let's say they want to go to the park, right? And they have homework to do, and you tell them, like, listen, if you go to the park, you're gonna get so tired that when you come home, you will not be able to get the homework done. So let's get the homework done, then we go to the park, so when you come back, you are free. All right? So that is actually helping them consider the risk and benefits of a decision that they make, and you feel they need a little guidance in. That's okay. And also assisting them in exploring their options. And also, you have to also consider experts, for additional advice. So a doctor, a therapist can be a real good resource. A teacher can be a really good resource to help your individual with disability get to the point of making a really good decision at the end. Okay, because sometimes having the disability, they want to so much express themselves that they don't look at the risk factors at times. But when you present all the options to them and really guide them in the different areas they want to go in or what they want to do, you actually are advocating for them by giving them the tools they need to be their authentic self in whatever they want to do. Okay.